Well, you saw Madison point to hospitalizations, and in the last 2 weeks alone, Erie County has seen an increase of 125% in hospital admissions. You can see the steady increase over the past 5 days, but hospitals are not the only ones being really stretched thin. Tonight, a local doctor tells 7 Eyewitness News reporter Ali Tui he's seeing the effects all over.
In late October and now November, we've seen everything change. And every week it's gotten worse.
Concern Wednesday from Jericho Road Community Health Center's founder and CEO, Dr. Myron Glick. Glick, who treats patients in their isolation units twice a week, took to social media Tuesday to update the community about what he's seeing on the front lines. In the post, Glick describes Monday as the health center's toughest day yet. He says unlike the last couple of weeks, they saw far fewer being tested to go home for the holiday or due to recent travel, and instead they treated many more who were sick.
It's the first time in this pandemic that I really started to feel afraid for myself and afraid for the community and what this may mean in the next 4 to 6 weeks.
Erie County Executive Mark Polenkar says overcrowding of Western New York's hospitals remains a concern, as does storing bodies if the death toll climbs. But he says they do have a plan if that should happen.
Sometimes there's things you have to be prepared for that you never want to be prepared for, but we will be prepared if necessary to store bodies in cold storage trailers if that's what it takes. I'm just hoping we don't have to do that.
The hospitals are pretty overwhelmed. I mean, they may not be saying this, but we know this because we work in the hospital. The rate of death is less, but the actual number of deaths I fear is going to be higher and I mean, almost too much to bear. I mean, it's going to be a lot worse in the coming weeks unless, and that was the point of the post, unless everyone starts to take this really seriously.
And Ali joins us live tonight. Ali, we're hearing about the growing concerns, right? We are washing our hands, keeping our distance, self-isolating. The question remains, what more can we be doing at home?
Well, Jeff, that's a great question. Staying home is actually the key, according to Glick. And if you can't stay home, again, we want to emphasize the importance of wearing that face covering if you are out, keeping your social distance, and washing your hands as much as possible. We just can't say it enough at this point. That will be the key to helping stop the spread and keeping you healthy. Jeff?
All right, our Ali Tui reporting tonight. Thank you very much. COVID